We now invite Dr. Jagdeep KAKADIA. Dr. Jagdeep, talking about Lazorex, the new slit lamp marking system for astigmatism management.
Jagdeep KAKADIA has many innovations to his name. He is a genius, and we are happy and lucky to have him with us. Yes, Jagdeep.
Thank you very much, sir, for the kind words. It's with the voice, please. Hello, dear friends and colleagues. Today we are very happy to introduce to you Lazorex, which is a laser-assisted toric axis marker, which is a great help for toric IOLs or for astigmatic keratotomy, and also for astigmatism control by on-steep axis incision placing in phaco or MSICS surgeries. Lazorex is very helpful and useful for Dr. Boramani and Bali's CICS technique. Lazorex is a small slit lamp mounted modular device having two powerful laser guns. First, the slit is made horizontal at 0 to 180, then with the first press of foot switch, very low power two aiming lasers come on, and then the slit is brought to cross the center of the pupil, and with the second press of the foot pedal, two powerful flash shots will create two linear burns marked on the test paper. After numbing the conjunctiva with proparacaine eye drops, the patient is taken on slit lamp and the head is best aligned. With the other eye closed, the patient is asked to fixate on this central red target light, which also gives a red Purkinje 1 image on cornea, denoting actual and real the position of visual axis in the pupillary area of cornea. After bringing the horizontal slit in the corneal center such that it passes through or just under the red dot Purkinje image, the laser shot is fired and two marks are done on cornea in microseconds. This is how Lazorex marks look on table. Marks remain as is, varies throughout the surgery, and they stay also afterwards for many hours. Lazorex marks stay as is for about 12 hours. So we can do marking in advance few hours before or just few minutes before the surgery. Another case. Same case on table. Notice the clockwise cyclorotation in the supine position. It is also a good method to do laser markings before dilating the pupil, keeping the slit horizontal and passing the slit through the center of the small photopic pupil. In this way, it is easier to align at 3 and 9 o'clock position. This 405 nanometer 5 watt near UV visible deep blue laser is completely and only absorbed by the corneal epithelium. These marks, they last for about 8 to 10 hours and they don't cause any pain or foreign body sensation in post-op period. Marks are only superficial, just the epithelial. They are painless and they disappear in less than 24 hours without any scarring. Intraoperative secondary marking with or without ink just by the pressure of desired axis can be done by Gimbel-Mendes ring or RC Shah toric marker. For those of us who cannot afford the high-cost digital image-guided toric marking systems, much less expensive Lazorex is a good and equally effective and equally accurate alternative. Lazorex module can also adapt a 4K video camera, so it can also convert the same slit lamp into a video or photo slit lamp. Recently, we have also converted one old Jowl Shears keratometer into Lazorex, in which laser guns are housed in these two boxes, and the whole bar can be pre-rotated to mark the desired axis, so we don't need to do secondary markings on table. Primary markings are the final markings. At the rate of marking 50 to 60 patients per day, these solid-state laser guns will work for over 30 years non-stop without any periodic maintenance, AMC or CMC. We have done over 4,000 cases by now at 4 centers with excellent and accurate results in each and every case. Accuracy of Lazorex is matching to that of Varian and Callisto. Lazorex is available in 4 options: just the Lazorex module for existing old slit lamp, Lazorex plus video glow for existing old non-photo slit lamp, Lazorex with a new slit lamp, or Lazorex plus video glow with a new slit lamp. By the way, the name Lazorex is coined by conjoining 2 words, laser and x-axis. Please don't worry about minor head tilts, in fact up to 14 degrees. The compensatory ocular cyclotorsion in sitting position will correct and keep the eyeball always in vertical real reference position, and in fact this compensatory cyclotorsion is one of the survival reflex. Actually, not being able to keep the eyes in erect position in tilted head position is a neuropathology, so please don't worry much about this. This is the link for an interesting 13 minutes video from Steve Mold about this erect eyes even in tilted head position. Let us try this. Please tilt your head to your left or right. And you can notice that the horizon in this scene as well as the screen will appear horizontal only and not as tilted. Here, please note that the nasal laser mark is always more accurate because the temporal mark may look slightly misaligned in few cases due to the unequal slope of cornea, especially in cases of asymmetric bow tie astigmatism with or without the skewed axis. Please don't worry or bother too much because astigmatic corneas are almost always optically never perfect. My excimer laser does not have automated cyclotorsion error detection and correction, so employing this zero line function, I use Lazorex markings for this purpose to find plus or minus axis shift manually. Thus, Lazorex is useful not only for cataract surgeries but also for ICLs and laser vision correction surgeries. Thank you very much for your kind attention.